So, good day everyone. I'm Bedpan Hernandez, first year college from PSN 1D. So now I'm going to demonstrate to you the assessment of giving and removing bedpan to our patient. First, I'm going to introduce myself to my patient. And verify his or her name. So, good day sir. I'm your student nurse for today. May I ask what is your name? Okay. So, how old are you now? Okay. So now we're going to proceed in explanation. First, we're going to explain to the client what we're going to do and why it is necessary. So the rationale of this is for the patient awareness in the whole procedure that we will be doing. Okay. So sir, for today, I'm going to give you a bedpan and also remove it. Is that okay to you? Okay. So next, we're going to proceed in doing some hand hygiene or observe other infection control procedure. So the rationale of this is to avoid the spreading of microorganisms or the cross-contaminations among patients or clients, or vice versa. Next, we're going to proceed in providing the client privacy. So the rationale of this is for the patient to be comfortable in the whole procedure. For example, we need to close the door, close the curtains. Okay. So next, we need to prepare all the equipments and the things that we will be needing. So first, for the equipments, we need the tissues or wipes and or towel, liquid soap, or lotion if necessary. Also, we need disposable gloves and especially our bedpan. Okay. So I'm using the plastic bedpan. Okay, now we need to wear our clean gloves before we start the procedure. Okay, so after wearing our gloves, now we will proceed in giving the bedpan with our patient. First, we're going to adjust the bed to a height appropriate to prevent back stain. Okay, so next we need to elevate the side rails on the opposite side to prevent the client from falling out of bed. Okay, so after that, we need to ask the client to assist by fixing the knees, resting the weight on the back and heels, and raising the buttocks by using a trapeze if present. Okay, so sir, kailangan niyo pong i-bend po yung knees niyo. Okay. So after that, we're going to help lift the client as needed by placing one hand under the lower back and resting your elbow on the mattress and using your forearms as level. Okay, so ma'am, kailangan po mag-lift ng kaunti. Next, we will check our bedpan. Okay, since our bedpan is plastic, we're not going to warm it by rinsing it with warm water. Okay, so next we're going to lubricate the back of the bedpan with a small amount of lotion or liquid soap to reduce the tissue friction and shearing. So I will put some lotion with our bedpan. Okay, so now we're going to place our regular bedpan so that the client's buttocks rest on the smooth, rounded rim plate, a sleeper pan with the flat, low, and under the client's buttocks. Okay, so ma'am, ilalagay ko na po itong bedpan po sa inyo and i-assist ko. Okay, so kailangan nyo lang po umangat ng kaunti. Okay, we need to ensure that it is put. Okay. So next, we need to provide move normal position. We need to move in normal position our patient for the client's lower back. Elevate the client's bed to a semi-Fowler position. Okay. If elevation is contradicted, we need to support the client's back with pillows as needed to prevent by hyperextensions of the back. Okay. So, ma'am, kailangan niyo po ayusin po yung position niyo para hindi po kayo nakikita. Okay, then we need to fix the bedpan because it might be disarranged. Okay, so after placing our patient in the right position and placing the bedpan, and now we need to cover our client with bed linen to maintain the comfort and dignity. So next, we need to provide toilet tissue, place cold light within reach, lower the bed to the low position, elevate the side rails if indicate, and leave the client alone for privacy. Okay, so we will proceed now in removing the bedpan. So when removing the bedpan, return the bed to the position used when giving the bedpan. Hold the bedpan steady to prevent spillage of its contents, and then cover the bedpan and place it in the adjacent chair. So straight, tatanggalin ko lang po ito sa una. Okay. So, sir, tatanggalin ko na po yung bedpan. Okay po ba yun? Okay, since our client cleaned his cells already, we need to cover him again. Okay, so after that, if the clients need assistance in cleaning his cells or herself, we need to apply gloves and wipes the client's perineal area with several layers of toilet tissues. If a specimen is to be collected, we need to discard the soiled tissue into a moisture-proof receptacle other than bedpan. For female clients, clean from the urethra toward the anus to prevent transferring rectal microorganisms into the urinary meatus. Then, we need to warm the perineal area of dependent clients with soap, water as indicated, and thoroughly dry the area. Okay, so for the next procedure, we need, for all the clients, after warm water, soap, a washcloth, and towel to wash the hands. Okay. So, next we need to assist the client so it's comfortable procedure, empty and clean the bedpan and return it to the bedside. Okay. Comfortable naman po ba kayo sa position nyo ngayon? Okay. So, next we need to clean the bedpan and place it in the bedside of our patient. Okay, so after cleaning the bedpan and putting it in the bedside, now we need to remove and discard our gloves and wash our hands. Okay, so after removing our gloves and doing hand hygiene, now we need to spray the room with air freshener as needed to control counter odor unless contained because of respiratory problems or allergies. So after spraying our room with air freshener, we need now to document color, odor, amount, and consistency of urine and feces and the condition of the perineal area. Okay, so after all the documentation, we need now to ensure that our patient is comfortable. Okay, so sir, are you comfortable today? No pain? Okay, so sir, sir, just call me if you need help. Okay, so now we finish all the procedure in giving and removing the bedpan with our patient. So that's how I demonstrate to you the assessment of giving and removing the bedpan with our patient.